Diabetes itself is a worldwide epidemic. The normal and acceptable way of eating is literally causing diabetes and obesity. In fact, this is such an epidemic that this year alone will have more diabetics diagnosed worldwide than we've ever seen before in the history of the world. Why do we care about this? Because diabetes is the leading cause of blindness here in the United States. It's also the leading cause of end-stage kidney disease or kidney failure, and it's one of the leading causes of non-traumatic amputations here in the United States. Diabetes leads to many uncontrolled infections. So diabetes in and of itself is a very destructive disease and one we'd like to stay out of if we can. So there's a movement for us to try to understand who is at risk and whether or not you actually have prediabetes. 90% of people who have prediabetes remain undiagnosed. And the reason why is because 90% of people with prediabetes have no symptoms. But in the prediabetes state itself, damage is actually being done to your pancreas. There's so much damage that's being done during the prediabetic state that about 50% of your pancreas is completely destroyed by the time you're ultimately diagnosed with type 2 diabetes. So if we wait until you're already a diabetic, we're already behind the 8 ball. As a physician here in Austin, we have shown over the last 3 years we do a fantastic job in reversing prediabetes and managing patients with early diabetes. It's very important for us to try to extend our knowledge to you wherever you're at to try to give you some help, a solution to this problem. If we don't all act together to try to solve this problem, we're in a whole world of hurt.